Good evening, everyone. Before we begin, we would like to say a land acknowledgement. Niagara Region is situated on treaty land. This land is steeped in the rich history of the First Nations, such as the Haudenosaunee, the Haudenosaunee, and the Anishinaabe, including the Mississaugas of the Credit First Nation. There are many First Nations, Métis, and Inuit people from across Turtle Island that live and work in Niagara today. The regional municipality of Niagara stands with all Indigenous peoples, past and present, in promoting the wise stewardship of the lands on which we live. Thank you for joining us for our town hall for parents and guardians of kids aged 5 to 11 years old. My name is Angela Lorenzo. I'm a program specialist in clinical services, and I will be moderating during the Q&A with Dr. Hergy and Dr. Kazmani. Dr. Hergy is Niagara's acting medical officer of health, and Dr. Kazmani is one of Niagara's acting associate medical officers of health. We'd like to go over a few housekeeping rules before we begin. Please type any questions you may have into the Q&A box located at the bottom of your screen. We will try to get to as many questions as possible this evening, but in the event that we are unable to answer your question, please visit our website. We are also happy to take your questions via phone or live chat. A list of resources and contact details will be made available in the chat. As with any virtual meeting, if you are experiencing problems with your internet connection and you're booted off, simply rejoin and we will let you back in. This session will be recorded for viewing later. I'll now pass it over to Dr. Hergy to get us started with the presentation.
All right, thank you so much for that introduction, Angela. And just to quickly note that Dr. Kazmani is a fully fledged Associate Medical Officer of Health. There's no acting title for him anymore. So good thing for that, because he is excellent. I'm just going to take a few moments to quickly talk through some of the details around the vaccination. This hopefully will actually address some of the questions that were submitted to us beforehand, and then we'll go to the live questions that you still have remaining. You know, I think when we talk about vaccination for age 5 to 11, the big question I think all parents and guardians are really wondering is, you know, why should you vaccinate your child? What are the risks? What is the importance of this? And I think, you know, it's well known that older people are the ones who tend to suffer the most severe illness from COVID-19. But unfortunately, sometimes children do also suffer some severe impacts from COVID-19. And one of the impacts that we've, I think, heard a lot about over the, last year and a half is this whole syndrome of long COVID, where people get COVID illness, they get better, but some of their symptoms don't completely go away and they linger on for quite a while. And you can actually see from some of the data there on the right-hand side what some of other countries have seen. In Italy, about 50% of children in that 6 to 16 age group had symptoms that lasted 4 months or longer. And, many of them were actually a little bit debilitating, and those children were actually unable to completely participate in their normal daily activities. In the UK, looking at a younger age group, 2 to 11, there were many children, about 15% of children almost, still had symptoms about 5 weeks later. And so one of the reasons to get vaccinated is, of course, to make sure children don't have to suffer these long-term symptoms after they get an illness. Sometimes those children do end up with more severe illness. And there's this particular syndrome here, which is called multisystem inflammatory syndrome in children. This is a side effect of COVID-19 infection, where children actually get inflammation of multiple different organs in their body. And you can see a list of the different organ systems there. And of course, many of these organs are actually critical to your life. And so this can actually be a potentially life-threatening illness for children as a result of getting the COVID-19 infection. When we actually take a look at some national statistics on COVID-19 illness, and really zeroing in on that age 5 to 11 age group, the age group that I think we're all here to talk about in terms of vaccination, these are some of the numbers that we see. So, 126,000 children as of mid-November had COVID-19 infection in that 5 to 11 age group, the age group who now potentially could be prevented from getting infection thanks to a vaccine. We had 300 children who were hospitalized with COVID-19 infection, 48 children who ended up in ICU, in many cases on a ventilator or a breathing machine because they had severe infection from COVID-19. And sadly, 2 children have passed away from COVID-19 in Canada in this 5 to 11 age group. And while these severe outcomes are fortunately not very large numbers compared to 126,000, it's obviously some children, and nobody wants this to be their child or for their child to be at risk of that. And the hope for the vaccine is, of course, that it is going to drastically reduce these numbers and particularly hopefully reduce these severe outcomes to almost zero. I'll just note that of those 2 deaths in the younger age group, we do know that at least 1 death under 10 occurred in Ontario just this past September. So it's hit very close to home. Now, one of the reasons why those numbers are what they are is 126,000 as opposed to being higher, is we've done a lot in Canada to control COVID-19. We sadly had to go through lockdowns. We've had lots of restrictions on social life. We're wearing masks all the time. We're keeping physical distance. All of that is really adding up to actually keep children safer in our society so that they're not getting infection as much as they would if things weren't as well controlled. When we look south of the border in the United States, they're not doing nearly as good a job of controlling COVID-19. And we sadly see some of what the outcomes of that are. So in the US, if we're taking a look at the age 5 to 11 group, 66 children have died of COVID-19 in just a 1-year period. So if you think of the US as 9 times the population of Canada, 2 deaths in Canada should translate to about 18 deaths in the US. Instead, it's 66 deaths. And those 66 deaths occurring in within 1 year actually means that COVID-19 is the number 7 cause of death for children age 5 to 11 in the United States. And that's what we thankfully prevented seeing happen here in Canada. But of course, we're not going to continue with all of our COVID precautions long term. At some point, things are going to completely open, and we want to make sure children are protected when that happens. And the vaccine is, of course, going to be part of what's going to make sure that happens. If we take a look at some of the other illnesses that we vaccinate for, we can see actually COVID-19 is pretty similar. So children get the chickenpox vaccine, usually at the 1 year of age, and again at 4 years of age. Lots of children will choose to get the influenza vaccine. If we look at the United States here, and how many hospitalizations were there per year before these vaccines came out and were starting to be used in children, you can see about 4 to 31 children were hospitalized for chickenpox, 30 to 80 children are vaccinated for influenza. That works out to about 25 children per 100,000 being hospitalized in that 5 to 11 age group for COVID-19. So very similar rate of children being hospitalized for COVID-19 as compared to these 2 other illnesses. And we vaccinate against these 2 other illnesses so children don't have to suffer that severe illness and be hospitalized. And I think likewise, we want to do that to make sure they don't get hospitalized for COVID-19. If we look at a similar data here for children and their rate of death per year from COVID-19, we have that 66 deaths per year in the United States from COVID-19. And we can see a bunch of these other infections here where we vaccinate. We do meningococcal vaccine. This one is in grade 7. Chickenpox again, rubella, age 1 and 4. Rotavirus, that's a vaccine usually given in the first 6 months of life. And you can see on average how many deaths there were per year in the United States from these different infections before we had vaccines for them, or at least we're using vaccines for children for them. And you can see COVID-19 is sadly a much more deadly disease than these different infections. And we vaccinate against these infections so we could prevent these deaths. And I think the argument is 3 times as strong here, given that deaths are 3 times more likely with COVID-19, that we want to vaccinate children to make sure we prevent these deaths. I want to take a just quick look at what we are right now seeing in terms of cases of COVID-19. And so just going to draw in what is the curve of cases we've seen, weekly cases per 100,000 population, and dividing it up by these different age groups here. And so you can see, we had a first wave in Niagara here for COVID-19, a second wave here, a third wave, and now we're hopefully past those big, huge waves that cause lockdowns, but we're definitely seeing cases go up. And I think what's quite marked here is you'll see this red line has really broken away from other age groups. And that red line is the under 12 age group. And of course, under 12 children have only recently been able to start being vaccinated, so they don't have the benefit of vaccine protecting them. And we can see the impact is that they are seeing more infection from COVID-19 than age groups who fortunately have had the ability to get vaccinated. And so children are sadly the highest risk group for COVID-19 in our society right now. To take a look at this another way, breaking down those younger age groups into some smaller groups here. And now I'm just going to start from July because there's a bunch of age groups here and this becomes a bit of a messy graph. And this is what it's looked like since the summer, once we started to reopen after our last lockdown. And you can see the red line here is where cases have been highest lately, and that's the 6 to 11 age group. The school age group, who has only just recently been able to be vaccinated, has not had the protection from vaccine. They are the age group that has the most risk from COVID-19. And I think that's partly why we feel so strongly these children should be vaccinated, because they are bearing most of the burden from COVID-19 right now. I just want to highlight that you can see this gray line is spiked up a couple times. That's that group just under the school age children, the kindergarten age children, age 4 to 5. They are also at quite a bit of risk. And here we see the orange line has come up to almost meet the red line. That's children under 4. So children who can't be vaccinated really are suffering the impacts of COVID-19 much more now than they have previously. And that's because they don't have the benefit of vaccine. Unfortunately, for those who are 5 to 11, there is an opportunity for them to get vaccinated and get that protection. Because there's so much more risk now amongst children for COVID-19, when we take a look at where we've been seeing outbreaks in Niagara, you can see this part of the pie here, which is yellow, which is the biggest portion of the pie. Those are outbreaks in the education sector, because sadly children are getting sick and having outbreaks in schools and childcare, and that's leading to them actually being the sector that's having the most outbreaks now. When we actually look in schools, and this data goes up to a couple of weeks ago, just before we started vaccinating children 5 to 11, we had seen in that 5 to 11 age group 180 infections linked to the school. So 180 kids who were 5 to 11 years of age had gone to school when they were infected and potentially exposed to others, or potentially got sick at school by being exposed to someone. And they had exposed over 3,000 other children, putting 3,000 children at risk of COVID-19. And if you're parents, you know that when a child is shown up sick at school, unfortunately, if they've exposed another child in their classroom or on their bus, those children now need to isolate and aren't able to attend school. And so that's a real huge impact on children. And this is really, in some ways, actually the bigger burden children are feeling, rather than just the health outcomes from COVID-19, is the fact that their learning and education is being disrupted from COVID-19. And so children are definitely feeling a lot of the burden right now, both in health, in terms of their schooling, in terms of their social life from COVID-19. And that's one of the reasons why we really do think we want to vaccinate them. I just want to take a moment, though, to take a look at what we see potentially coming forward. So you're probably all aware that Ontario has seen its cases go up of late, and we're now seeing about 1,000 cases a day in Ontario. And the Ontario Science Table yesterday released modeling showing what we can expect over the next 6 weeks or so from COVID-19. And so this is a graph showing Ontario's cases. Starting in November, they started to go up, and you can see they've come up to about 1,000. And we are right now on this red trajectory where cases are going to get up over 2,000 by the end of the holidays, pushing into 3,000 almost by middle of January. And that's assuming that about 30% of children are going to get vaccinated in that 5 to 11 age group. You can see this yellow line is if 50% of children get vaccinated, and you can see there's far fewer cases. And that's because there's a lot of children who are making up these additional cases, and a lot of children then spreading infection to other children. And if we are able to get a higher number of children vaccinated, there's a lot of children who make up this difference between the yellow line and the red line, who are going to be protected and who are not going to get sick from COVID-19. And I'm sure everybody's been paying attention to the news. We're seeing the Omicron variant now spreading. We're seeing actually news out of Europe that it's rising very rapidly. And this was again by the Ontario Science Table, just showing in South Africa what's happened with the Omicron variant. And you can see this line here, both the orange line for hospitalizations and the dark line for cases have basically pretty much gone straight up. Fortunately, we're not seeing that many cases here yet, but if this is how quickly the cases rise when the Omicron variant does arrive here, potentially children are going to be at a lot of risk because they're not going to have any protection. And I think it's really important we start the process of vaccinating children. It's going to take 8 weeks between that first and second dose to vaccinate children. And so if we can get that first dose in, we're going to hopefully be able to get that second dose in before we start to see this big spike upwards of cases potentially happening here. And we're going to be able to keep children safe. So I've talked a lot here about why I think it's really important we get children this protection from COVID vaccine. And the great news is that we have a vaccine for these children that's really effective. It's over 90% effective against COVID-19, and that's against COVID-19 with the Delta variant. But even more important of how effective this vaccine is, actually, it's a very safe vaccine. And I just want to actually highlight here, what this looks like. So this is going to be a complicated graph, so I'm going to slowly build it up for people. This is a little graph here that's showing how often do children get fever after being vaccinated. I think we all know sometimes, you sometimes get a vaccine and you get some, kind of fever, muscle aches and the like after that vaccine, and then you get better, and that's just the vaccine working and building immunity in you. And we see here, this is the 5 to under 12 age group. So basically the children age 5 to 11 getting their vaccine. And this is children age 16 to 25 getting their vaccine. So slightly older children and young adults. And how often did these people get fever? So you can see 6.5% of children ended up suffering from that fever as a effect after the vaccine. Amongst that older age group, we had 17% of them suffering from a fever. And so almost 3 times higher. And so actually young children are actually more protected from those side effects of the vaccine. They're less likely to get that fever. If we take a look at another side effect here, fatigue, you can see again, the children 5 to 11, less likely to feel fatigue after being vaccinated than were older children and young adults. If you look at headache, again, children 5 to 11, less likely to get a headache. Chills, children, maybe a quarter is likely to get chills. Vomiting, less likely to suffer vomiting. Diarrhea, children less likely to get diarrhea. Muscle pain, children 5 to 11 less likely to get muscle pain. Joint pain, children 5 to 11 less likely to get joint pain. Across really all of these, common, relatively mild symptoms that you might get after vaccination, children are much less likely to get it, which seems to imply that we actually have a safer vaccine for children that gives them fewer side effects while still giving them that really strong protection. And of course, most importantly is that when we look at really severe impacts of the vaccine or from COVID infection, children who are vaccinated, none of them got severe cases of COVID-19 in the research studies. None of them got myocarditis or pericarditis after the vaccine. None of them had a severe allergic reaction. And none of them got that multi-system inflammatory syndrome in children, which I started off this talk talking about. So children are absolutely, I think, getting a very safe vaccine if they do choose to get vaccinated. We've been, of course, doing vaccination for a little bit already. You can see here, these are the first dose uptake amongst people across our society. Over 88% of adults have already been vaccinated with that first dose. 79% of children who are over 12 or over have already gotten that first dose. And we're actually now up to almost 20%. And actually after today, we are definitely over 20% of children aged 5 to 11 have now gotten that first dose. And you can see here some of the data on second doses. We're of course not yet doing second doses for 5 to 11, but you can see 3/4 of older children are fully vaccinated with 2 doses. And so we have a good track record now of the vaccine being used, and we're definitely seeing the vaccine is protecting people and it's keeping them safe and they're not having side effects. So hopefully I've convinced you that getting vaccinated is going to be a really good choice for your child. And if you want to book your child for a vaccine, you can come to the website ontario.ca/bookvaccine and book your child in for a vaccination at one of our public health clinics. Other options, of course, to reach out to your primary care provider, and if they're doing vaccination, you can get them vaccinated in the primary care office where they probably got a lot of their other vaccines, or to the local pharmacy if that's more convenient, and many pharmacies around the region are also doing vaccination. If you choose to book here, you'll be met with the web page that looks kind of like this. Click on that you want to get your child their first dose and continue working through. Make sure you have your child's health card available so you can enter that information. If you don't have a health card, no problem. Just call the phone number for the provincial booking tool, which is also on this website, and they will help you out with getting your child vaccinated. And then on the day of the vaccination appointment, make sure to come just a few minutes early. We don't want to have long lineups of people in the cold, so come just a few minutes before your appointment so you're not waiting out in the cold. We do need a child to have a parent or guardian with them ideally, because we will want to talk with them to make sure we have consent to do the vaccination. If you have someone else bringing your child, please be available on phone so that we can talk to you on the phone to make sure we have consent by a parent or guardian before vaccinating them. Obviously, bring that health card again so we can link that health card to your appointment. Have your child wear a short sleeve or loose fitting top so we can make sure to get to that arm and actually give them their vaccine. Obviously, have them wear a mask to make sure we're protecting everybody in that clinic from COVID-19. And if your child has a toy or a book they really enjoy, please have them bring that as well. And they can, of course, keep themselves entertained with that. If they don't bring that, we're going to have lots of things actually at our clinics to help keep children entertained and help reduce their anxiety. And I just want to highlight here that the St. Catherine Standard a couple of weeks ago did an article really highlighting the whole process our clinics work through and all the different things that we're doing to hopefully reduce the anxiety and make it a really comfortable experience for children. And if you actually go onto social media, you'll hopefully see lots of different reviews from many parents highlighting how good the experience has been getting the vaccine. So with that, I'll stop there and I'll turn it over to Angela to moderate us through the questions.
Okay, thank you, Dr. Hergy. So our first question is for you. In your presentation, you mentioned a comment about 2 children dying from COVID-19. Do you know if the children who passed away had pre-existing health problems?
Yeah, unfortunately, I don't have information on that. We don't have a lot of detail released on those deaths, obviously, to protect people's privacy, so I don't know much detail around it. I do want to note, though, that, of course, whether a person had pre-existing conditions or not, they're still a child, a young member of our community, and it's, of course, very tragic that they passed away. And we, of course, want to try and prevent as many of those deaths as possible.
Thank you. Okay, Dr. Kasmani, what is the best way to approach my child about getting a vaccine? I want it to be their choice.
Yeah, that's a really good question. Thanks for asking. I think it's always important to be respectful of them, to be honest, to be open. I've done some videos and we'll be making some more where kids can ask questions they have. So hopefully that will answer some of the specific ones, and that'll be posted on social media. We've already done a tour of our clinic, a walkthrough there where kids can see what they'll expect there. And so it's really important to explain to your children what vaccines are, that they provide instructions to our body on how to respond to germs. And then our body uses those instructions that they learn to naturally fight off the germs if they encounter it later on. And it's important to be honest. So the vaccine might sting for a minute initially. They might have some mild side effects. Dr. Hergy went through those in his presentation, and they usually last maybe a day or two. But then it really helps protect them from getting sick with the virus or the germ. And some kids can get very sick, as we've seen, including needing to go to the hospital, needing to go to the ICU. And it helps to protect their family and their loved ones as well.
Thank you. Dr. Kasmani, will there be vaccines available for primary care doctors to administer instead of going to a mass clinic?
Yeah, so the best thing you can do is talk to your primary care provider, whether it's your physician or nurse practitioner, and see if they do have it at their clinic specifically, because every family doctor will be doing things slightly differently. Some of them in town, pediatricians, family doctors, they may have them. And so it's worth connecting with them directly to figure that out.
Thank you. Okay, Dr. Hergy, the mother of my firstborn is concerned about potential inflammation as a side effect of the vaccine. She reports that her asthma was exacerbated after her second dose of vaccination and is concerned for our child. I'd like to assure her fears so that she consents to our child's vaccination.
Yeah, so I think they're really worrying about, the risk of any kind of inflammation from the vaccine, and they want to make sure that their friend has that information so they can, consent to that vaccine and make that educated choice to move forward. So, I showed you some of the side effects from the vaccine. Part of what the vaccine does is really revving up your immune system. And part of revving up your immune system is you might get some of those fevers, you might get some of those muscle aches. It shouldn't normally cause any sort of breathing issues, though. So I would not expect there to be any problem for a child who has asthma really suffering that as a side effect. I think it's going to be more If they were one of the unlucky few who does get those more, systemic side effects that are more than just pain or redness at the arm, it's going to be fever, it's going to be muscle aches, those sorts of things.
Thank you. Dr. Hergy, it usually takes 8 to 10 years to develop a vaccine. So how was this vaccine created so quickly, and how do we then know the long-term effects? Dr. Hergy, do you want me to repeat that one again?
I thought you were asking Dr. Kasmani that question. Apologies. Yes, could you repeat it again?
Yeah. It usually takes 8 to 10 years to develop a vaccine. So how was this vaccine created so quickly, and how do we then know the long-term effects?
Yeah, so the vaccine was created really quickly because we weren't starting from scratch in developing this vaccine. There's been a lot of research over the last 20 years developing, first of all, the mRNA platform for vaccines. So there's a big head start on that. And the second thing is that the COVID-19 virus is very similar to the SARS virus back in 2003. And a lot of work was done to actually develop a potential vaccine against SARS. So when COVID-19 rears its head, it was actually a matter of just adapting that prototype vaccine that is already available to the COVID-19 virus. And fortunately, that work actually turned out to be really successful because we ended up with a vaccine that's very safe and very effective. In terms of long-term side effects, we've never had a vaccine that's had long-term side effects. mRNA is actually really unstable. You've probably heard that these vaccines need to be stored in these super cold freezers. And that's because if you store that vaccine at room temperature, the mRNA basically just breaks down. It can't survive. And so when it's injected in your body, it doesn't last very long. It actually breaks down after a couple of days. But what it does is what Dr. Kasmani just said, is that it's actually trained your immune system over those couple of days to recognize the virus if that virus does ever show up, so your body is able to fight back against it. And so there's no long-term impacts from any vaccine we've ever seen. The only long-term impact is the immunity you have. And there's every reason to believe that the mRNA vaccines will be the exact same thing, because the vaccine basically breaks down and it's gone. And the only thing that remains is what it's trained your immune system to do.
Thank you. Okay, Dr. Kasmani, can't kids always have lingering symptoms for a while with even a cold or flu?
Yeah, that's a good question. And I think that, they do often have lingering symptoms with other viruses as well. But here we have an opportunity to prevent them from having lingering symptoms from this virus. And I have young kids too. And if I had that opportunity to prevent those symptoms for all viruses, I would certainly take it. And especially this one, where not only can they have lingering symptoms, but they can have some really bad immediate symptoms as well.
Thank you. Okay, Dr. Hergy, I have a few questions in this one. If there are only 2 deaths in the age group of 5 to 11 in Canada, only 1 in Ontario, why are you recommending vaccinations in children in this age group?
Yeah, so I think this goes back to all of the things that we've done to protect ourselves from COVID-19 over the last 21 months here. Lots of restrictions, schools were closed for periods. All of that has actually prevented the spread of infection and prevented kids from getting infected. So we haven't seen what the full impact of it would be if every child got COVID-19 in the country. In the US, I showed you that if there's 2 deaths in Canada, there should be about 18 to 20 deaths in the US. Yet they've had 66 deaths per year, so even higher if you're looking at the entire course of the pandemic. And that, I think, speaks to if infection is spreading through children, unfortunately, many more are going to get sick, and a fraction of them are going to have severe outcomes, including death. And we're going to get to that point here in Canada. We're not going to continue to have all kinds of restrictions and altered lives due to COVID-19. Eventually, things are just going to open up, and the virus is going to spread through everybody who's not yet been vaccinated. And we want to make sure that we can protect as many people as possible for when that day comes, so that the children who are around have protection, so that they're not getting infection and risking getting COVID-19 and getting the severe outcomes from COVID-19. And so that's the reason. And I just also want to highlight that, of course, every child's death is tragic. And the last thing you'd want is, while the risk is pretty low, that your child would be the one to suffer from that. And of course, death isn't the only severe outcome. There's being hospitalized, there's being in an ICU, there's getting long COVID. There's all of those other impacts that could happen as well.
Thank you. And Dr. Hergy, part of the same question, how many vaccines have been administered in this age group to date in Ontario? And have there been any adverse effects from the vaccinations in this age group that have been identified?
Yeah, I don't actually know what the exact number is in Ontario right now. It's in the hundreds of thousands, but I haven't looked up recently what the current number is. It's a little over 20%, though, of children in that 5 to 11 age group. So a pretty large number has been vaccinated. And as of yet, we haven't seen any significant evidence that there's any kinds of severe side effects that children are suffering. Overwhelmingly, the information we're hearing is that children are having a really good experience with the vaccination. I think, if you want to see a bigger data set, you can look south of the border where they had a vaccine for children starting really in early November. And they're, closing in on, I think, 4 million children now have been vaccinated. Dr. Kazmani is correcting me, it's actually close to 5 million now. It's changing very rapidly because lots of children are getting vaccinated in the US. And so they have a lot of children vaccinated, and it's been for a longer period of time. And thus far, they have not seen severe side effects, including they haven't seen myocarditis or pericarditis yet occurring from that child vaccine. So, really good news that the vaccine is being really safe for these children.
Okay, thank you. Dr. Kazmani, why a year back were we told that children were safe and at low risk to experiencing major symptoms of COVID, and now there's such a push to vaccinate? As a population, we are blaming those that are unvaccinated for spreading the virus. But if we look at the numbers as a whole, it's about 50-50.
Yeah, so that's an interesting question. And I think that falls into some of the way the numbers are presented. If you look at the number of people who are infected at the rate of people who are infected, far and away unvaccinated people, considering unvaccinated people only make up 10% of the population in Ontario and make up 50% of the cases, that's a huge difference, right? Whereas 90% of the people who have at least one dose of vaccine make up a far smaller number, or proportionately. That's an important thing to consider. And we do know that overall children have milder symptoms than the elderly. But that doesn't mean that all children do. And the other thing we've seen is that new variants, the virus has mutated, the variants have changed the spread. So the original COVID, we used to do extensive studies in schools and we didn't see that much spread. That changed when Alpha came. That changed when Delta came. And now when we look at Omicron and the data out of South Africa, 80 children, for example, in the span of a couple of weeks were admitted there to the hospital because of infection with Omicron. So certainly we see a couple of things. One is the rate, that there'll be a much higher rate of infection in the unvaccinated. And the second thing is that as the variants, as the virus mutates into variants, we're seeing more spread amongst children.
Thank you. Dr. Kazmani, a friend of mine has a child younger than 5 years old and was wondering if the healthcare community is planning on vaccinating children younger than 5 years. They want to vaccine their child.
Yeah, and so my children fit into that as well, and they are under the age of 5. And so I'm in a similar boat. We're hearing that those trials are still underway. They're still testing the vaccine, seeing the effectiveness. And the other reason is also that it's a different dose. So it's going to be an even smaller dose. So we already know that the dose for the 5 to 11-year-old vaccine is 10 micrograms. The dose for 12 and older is 30 micrograms, so it's 1/3. And this dose for children under the age of 5 is going to be even lower because their immune systems are stronger and they'll respond better. And that's probably also why we see less side effects. So the hope is that those studies will be done, completed. We'll be sure that they're safe, effective vaccines sometime early in the new year, sometime in the first quarter or so. That's the hope.
Thank you. Dr. Hertie, I believe you showed the data regarding side effects only for the Niagara region, but what about worldwide? What about the number of severe side effects for kids who received the vaccine in the US or the UK?
Yeah, so the data I showed on side effects was actually from their research studies, the clinical trials they did to test the vaccine. We've, of course, not been vaccinated for very long here in Niagara, so there's not a lot of track record yet for that. So the clinical trial really gives us the best data on that. I talked a little bit about the US data, and I've been paying attention to the US data and going on to their public reporting of that, because as Dr. Kasmani mentioned, we've got 5 million children there vaccinated. It's a huge group of children that we're actually able to see what the impacts are. And thus far, we're not seeing severe side effects from the vaccine amongst them. I'm not as familiar with the UK data, so unfortunately, I can't comment on the UK data.
Okay, Dr. Hergy, with the holidays approaching, kids will likely only have one vaccine dose. Will a single dose provide adequate protection for children aged 5 to 11 to gather with fully vaccinated adult family members or multiple households without a mask?
Yeah, so this is a difficult question because I don't think there's any scenario where you're at zero risk and you're 100% protected. And it's a little bit of a judgment call of, how much protection are you comfortable with? What I can say is that with one dose of vaccine, a child is going to cut their risk, by 2/3 to 3/4. They're going to have far lower risk of getting COVID-19 infection. And I think it's the most important thing you can do to make sure your child is going to be safe when we do have those holiday gatherings. So if you are planning to have holiday gatherings with other households where you're going to actually have everybody to be fully vaccinated, I absolutely, support that, and then support that you would make sure that your children are going to have at least one dose of vaccine so that they'd have that level of protection. Obviously, it's not zero risk, and I think as a parent, you may choose that maybe you don't want to have other households over and actually just keep it to your nuclear family just to keep your children extra safe. And I think that would be a reasonable choice as well. I think if your children are unvaccinated or you have unvaccinated members of your family coming over, that's where I would start to really worry, and that I would strongly discourage. So if you're going to have gatherings with extended family, friends over, I do definitely believe you should only do it if you've had your child get that at least one dose of vaccine so they have that significant protection. We are seeing that when there are big gatherings, we do see a lot of infections sadly spreading, especially when that gathering has some unvaccinated people. And so we want to make sure children are safe, especially since we're entering a more risky period right now in Ontario.
Okay, Dr. Hergy, will travel isolation guidelines for double vaccinated 5 to 11-year-olds follow the current rules for 12 to 18-year-olds?
So that's a decision made by the federal government. So I don't know for sure, but I would imagine that it would. I can't see a reason why they wouldn't treat fully vaccinated children 5 to 11 any different from fully vaccinated children that are greater than 12 years of age.
Okay, Dr. Kasmani, will this be a mandatory vaccine for children? If so, if the child is not vaccinated, will they be able to attend school or will they have to do online learning?
Yeah, so a good question. Ultimately, these decisions are made by the province and the politicians on what's mandatory and what's not mandatory. Certainly I'm not in that position, but from what the province has said so far, the plan isn't to make it mandatory.
Thank you. Dr. Hergy, do you think the vaccinated people are the spreaders of the Omicron variant since they are the only ones allowed to travel?
I don't fully understand the question, but if they're saying that vaccinated people are the fault for spreading the Omicron variant, I think that's a bit of a stretch to say. There are people who are unvaccinated who are still able to travel. They do have more restrictions when they travel. They do need to quarantine. So it could definitely be all sorts of people who potentially are spreading the Omicron variant. I think really what we should see is that this is, not really anybody's fault necessarily. This is just sadly the evolution of how this pandemic is going. And sadly, it's evolved to create this new variant that does seem to spread more easily and is going to be more difficult to control. And, not getting into fault, because I think that's kind of pointless, is what can we do about this? And I think what we can do about this is to make sure we, redouble on all the things that protect us. And the most important thing that protects us is, of course, getting vaccinated. And so I think it's an argument to make sure we get fully vaccinated. And when we become eligible for booster doses, likely to get those booster doses as well.
Thank you. Dr. Kasmani, will my child have any problems with reproductive health in the future?
Yeah, that's another good question. And it's one that there's a lot of rumors about. So I'm glad you asked it. I would fairly confidently say no. There has not been any signal of that. In fact, there has been some signal that people who are infected by COVID-19 go on to have challenges. But this vaccine in adults has been around for a year now, and we haven't seen any of those types of changes in reproductive health at all. Unfortunately, that's a common rumor that we hear about and makes people question the vaccine, but I wouldn't have any concern about that. And the other thing we do know as well is that the vaccine is very safe and effective in pregnancy. We have seen many pregnant women get it, be very safe. My wife got it while she was breastfeeding as well. And so I wouldn't recommend anything to anyone that I wouldn't recommend to my own family.
Thank you. Dr. Hergy, just a few months ago, the Science Table and the World Health Organization stated that children aged 5 to 11 were very low risk for COVID, and now all of a sudden they are very high risk. Why the sudden change?
Yeah, so there's, I think, a couple of things that have really changed from a few months ago. A few months ago, we weren't dealing with the same variants that we were right now. And as Dr. Kasmani spoke about a little bit earlier, when the Alpha variant came, it's started to put children at greater risk. When the Delta variant came, it started to put children at greater risk. And particularly we saw actually with the Delta variant that we started to see more hospitalizations of younger people, both young adults and even getting into children. And so that's one big thing that's changed. And so while that advice earlier that children were at lower risk was true in the past, it's sadly no longer true with the new variants that have emerged and are spreading right now. The other thing that I think has changed is really just the way our society is operating right now. Children are pretty well protected in the past because we had a lot more restrictions in society. Schools were actually closed for over half of last school year, which really limited the infection spreading. A lot of sporting, extracurricular activities that children would be part of were canceled. So that really limited their chances of being exposed to the virus. We're now in a different place in the pandemic. A lot of those extracurriculars are back open. Schools are, of course, open. In secondary school, we've actually had schools move back to normal schedules where children are now actually around a lot more other children. All of that is putting children at greater risk of getting the COVID-19 virus. And so it's putting them at a lot greater risk. And so for both the change in the variants and just the change in how our society is living, children, of course, are at more risk now. And of course, it's not just going to stop here. We're going to get to a point where we completely reopen society, and the virus will not be impeded from spreading through everybody, and anybody who has not been vaccinated is going to get the infection. And so we want to make sure that children have some protection before that day comes.
Thank you. Dr. Kasmani, where can we find the data as to how many children were in the trials of the vaccine?
So I'll ask the team to post that link there, but there's a paper in the New England Journal of Medicine. It's an open access that anyone can go and read. You don't need to be a subscriber to the journal or to pay for it. And it has all the data that they had presented there, including those charts that Dr. Hergy presented earlier as well. And then I'll ask the team. Oh, there it is, right there.
Thank you. Dr. Hergy, will the COVID-19 vaccine eventually be administered in school, as has been done in the past with the Hep B vaccine?
It's too early to say if that's going to be the case. Definitely not within the next few months are we going to be doing any kind of vaccination campaigns in schools. Unfortunately, with COVID still being a thing, and we're trying to make sure we keep children safe in schools, all the space in schools, gyms, libraries, everywhere is being used so we can space children apart as much as possible so we can keep them safe as much as possible, which means there's no real space for us to go in and actually run a vaccine campaign. The other part is vaccinating children in the school is just not as efficient as vaccinating a big center in the community. And so we're not able to vaccinate as many children as quickly. So it's not something we're looking at in the near future that's going to be done. If we're thinking about longer term, I don't know what the recommendations around vaccinations will be. If it ends up being that, vaccines are delivered to school-age children or booster doses are delivered at the school age, it's certainly possible at some point in the future we might be doing some vaccinations in the schools for that. But I think that's something that's going to be years down the line. I think in the near term, the goal is going to be to try and vaccinate as many people as possible. And that's going to be vaccinations done outside of the school setting.
Dr. Hergy, is it possible to say that the variants are a result of the vaccination?
I would say actually the variants are the results of not vaccinating. So anytime the virus spreads, it's going to mutate a little bit. And, it's basically kind of testing out different mutations until it finds a mutation that gives it some kind of advantage so it can spread more easily. And when it does spread more easily, that becomes kind of a mutation that, has some stability and ability to spread widely, and it becomes a variant because we start to see a lot of it. What's happened is that in other countries around the world, they have not done as good a job of controlling COVID-19 as we have here. And when they haven't controlled COVID-19, the virus has kept spreading, it's therefore kept mutating. And through random chance, some of those mutations have ended up being ones that give it a survival advantage, and that's become the variants. So we saw the Alpha variant, it arose in the United Kingdom during a period when the United Kingdom was seeing huge waves of COVID-19 and not protecting against it. The Beta variant looks like it originated in South Africa when South Africa wasn't controlling COVID-19 well. The Delta variant originated in India when India was going through a massive surge of COVID-19. And most recently, we have the Omicron variant. I don't think we figured out quite where it originated, but we think it's possibly originated in Southern Africa. And the key thing about all of these countries is that the infection was spreading out of control because they did not have a lot of vaccine to stop the spread of infection. And I think it's the failure for us to get vaccine to places like India to stop the Delta variant and places like Southern Africa that we've seen these new variants emerge because they have not been able to control COVID-19 as well as we have here in Canada. And so I think absolutely the vaccines are what will stop the variants. And one of the important things I think as a society we need to do is make sure we do more to help the rest of the world be vaccinated so that we stop seeing new variants emerge.
Thank you, Dr. Kasmani. If a child has received another vaccine, such as a flu shot, what is the waiting period to receive the COVID-19 vaccine safely?
In general, for kids under 12, we recommend that you wait 2 weeks between vaccines, whether that's the flu shot or their regular vaccines that they're getting. And between those vaccines and the COVID vaccine, either before or after.
Thank you, Dr. Kasmani. My child, age 6, gets sick very often, almost every 3 weeks. What side effects do we have to be concerned about?
From side effects from the vaccination, yeah.
Mm-hmm.
So I think the main ones to be concerned about, they're very mild, they're short lasting. They're the ones that Dr. Hergy identified in his presentation and are available in that paper. As you said, there have been almost 5 million doses of vaccine given, or 5 million children who've received the vaccine in the United States. We haven't seen any significant serious side effects. As we noted, there was an initial worry about the heart problems, the myocarditis or the pericarditis, and we have not seen that signal in children under the age of 12. So that's really reassuring, but mostly they're mild, they're short lasting, arm pain, maybe muscle aches, feeling warm or feverish, and just maybe feeling out of it for a day or two. The people I know who've had their kids get it, their kids have done very well afterwards, maybe a bit of a sore arm, but again, it's been very well tolerated.
Thank you. Dr. Hergy, my child will be 12 in January. Should I wait a month so that they can get the full dose?
Yeah, so my recommendation would not be to wait that month to get the full dose. We're heading into, I think, a pretty risky period over the holiday season. Last year we saw a big spike of infections over the holidays, and I think we're going to see a spike of infections of some sort over the holidays. And I think it's really in the child's best interest to get some protection now. I also think that if you get the current dose of the vaccine now, you're going to get the same protection that you would with waiting for that adult vaccine. So the child's not going to get any benefit from waiting. They're just going to get the benefit if they get the dose now and get the earlier protection.
Dr. Kasmani, what should I do if my child has an allergy, anaphylaxis, or had a previous reaction to a vaccine?
Yeah, so what we've learned about these vaccines is they're very, very safe. They're very effective, and they have a different makeup than many other vaccines. And so in general, what I would suggest is that talking to your physician, whether that's your family doctor or your nurse practitioner or your pediatrician, they can see what aspect your child has an allergy to and whether you need to be seen by a specialist first, and they can direct you to that. And even for children who have allergies, these vaccines are extremely safe, and sometimes they need a little bit of medication before or some steps taken before, but certainly there are ways to give it in a very safe and effective. But your family doctor or your pediatrician or your nurse practitioner will be able to answer in your specific case what the best steps to take are.
Thank you, Dr. Hergy. How can I be confident that there won't be any long-term side effects since this is the first mRNA vaccine ever given to children?
Yeah, I think we answered a very similar question earlier around that. And we've never had a vaccine that has long-term side effects. The vaccines, come into our body, they tend to be broken down, and all that remains is immunity from it. With the mRNA vaccine, as I mentioned earlier, this is a vaccine you've probably heard is stored in super cooled freezers. And that's because it's really unstable. It can't survive in normal temperatures for very long. And so once it's been in our body for a couple of days, it's basically broken down and our body, basically excretes it. What remains though, it's trained our immune system over those couple of days to recognize the COVID-19 virus if it ever comes across. And so, there's no reason to think that there could be any long-term side effects. We've never had a vaccine causing long-term side effects. What we do know is the vaccine will give us long-term protection though, and that's what we see with every other vaccine.
Dr. Kasmani, my son was born with an innocent heart murmur and hasn't fully outgrown it yet. Would there be any implications to him being vaccinated, given that in the past, since there was some heart side effects reported specifically in boys?
Yeah, so for an innocent heart murmur, no, I wouldn't have any concerns there. In general, again, 4.8, almost 5 million doses of COVID vaccine have been given to children under 12, and we have not seen a signal for heart problems there. And so I think that's fairly reassuring. I had an innocent heart murmur when I was young as well, and so it's very common. But we haven't seen any heart problems. But if you do want to talk to your own family physician, nurse practitioner, or pediatrician about this, they can also reassure you.
Thank you, Dr. Kasmani. So we're getting close to 8 o'clock. We're coming to the end of our session. Dr. Hergy and Dr. Kasmani, do you have any key takeaways for us?
I think just quickly from my perspective, this is a very safe, effective vaccine. As I mentioned earlier, my children are too young to get it, and I wish that there was one available for children their age, or that they were of the age where they could get this one. I would have no hesitation. I have no hesitation recommending it to my friends, my family, my neighbors, and the ones who have gone to our clinic so far have had a very good experience. And as Dr. Hergy was saying, we are going to a period now where we'll see more transmission. We see how effective the vaccine is, where we're not seeing outbreaks in our secondary schools, but in our where I think about 80% of the population of that age group has been vaccinated. But in our elementary schools, we continue to see cases. We continue to see children get sick, and we continue to see children miss school as well. But the vaccines are very, very effective. They're very safe as well. And so I wouldn't have any hesitation recommending them or giving them to my own children if they were allowed based on their age.
Yeah, I think Dr. Kasmani said pretty much everything there. We're definitely sometimes seeing severe outcomes for children when they get the COVID infection. We see a lot of safety from the COVID vaccine. And it just, I think, makes so much sense that we can give these children this protection, especially as we go into a more risky period for them in the coming weeks, that we can give them protection so that they don't have to get sick over the holidays, come out of the holidays with potential illness, or be one of those unlucky ones to have a more severe side effect. I know this is a really difficult decision for a lot of parents, and I really encourage parents to take a look at the sources out there that are reliable to get more information. Go onto our website at niagararegion.ca/COVID-19, and we have lots of information on the vaccine, so you can read more about it. Talk to your family doctor. Your family doctor has probably given lots of vaccines to your child, so they will know all about your child's history. They'll know how your child has handled vaccines, and they'll be able to give you some really good information if you have further questions. And, take a look at, some of the information from friends, family members who may have had a child who got vaccinated, some of the reviews online. Overwhelmingly, we're seeing such positive feedback from children and parents who've gotten their child vaccinated. And I think as we see that, it really gives us, confidence that, people who've gone through the vaccination are not regretting that decision. And hopefully that'll be a decision that you come to as well.
If I can just add one more thing, we all have friends going to medical school who are physicians, and every physician I know who has a child who's eligible rushed to get their child vaccinated right away. And so if doctors are doing this, I think every physician I know has got their children vaccinated. And so if they're doing it for their own children, I think they're recommending it for everybody else makes sense as well.
Thank you to everyone for spending part of the evening with us tonight. Before we log off, I just want to share one kind comment that we received. This is from the mom of a 6-year-old, and she says, "This is a wonderful presentation and very much appreciated." So thank you to everyone, and enjoy the rest of your evening.